We are going to talk about my background in microneedling, what jowls are, why collagen loss matters, how microneedling can help jowls, professional versus at-home microneedling, why Banish is designed for jowls. I'm going to do a little bit of a demonstration on how you can treat jowls, how to do this safely at home because safety should be our number one priority, who should not microneedle, and realistic results question and answer. Okay, so I'm just checking the chat. Okay, welcome Elena, Melanie, so good to see y'all. Okay, let's get started. So I'm going to quickly share my background and my story so you know what makes me authorized to speak about this. So my name is Daisy Jing. I'm the founder CEO of Banish. I've had this business for over 13 years, and I've suffered with every single skin condition known to man, but specifically I suffered with a lot of cystic acne. You know, it really affected my mental health, my self-confidence. People would call me gross, ugly, disgusting, put a paper bag over your face. So in school, I actually would just sit in the bathroom stall and wait for recess to be over. It truly affected the way I viewed myself and affected my self-confidence. So I tried out every single product known to man, went to every single dermatologist, naturopath healers. I mean, in my teenage years, like obsessing over my skin was the number one priority I had. So when you would ask me, what do you want to be when you grow up? I said, I want to be a dermatologist because I knew a lot about skin. So I actually went to Duke University to study pre-med, and I took all the organic chemistry classes and, stats and clinical, all the classes you're supposed to take to become a dermatologist. And there in my dorm room, you can see here, I am reviewing different beauty products on the internet. This was over 15 years ago. You can see how old these videos are. But I was one of the first online beauty gurus to really review beauty products. And the way I would review them is I would go through the ingredient list and kind of talk about how it affected your skin. And this was when I realized a lot of skincare products out there, they put a lot of artificial fragrance, they put a lot of filler ingredients that would damage the skin barrier or irritate it. And I soon realized that a lot of what I was putting on my skin to treat acne would actually irritate my skin worse and make it break out than actually treat the acne. So I also want to preface by saying my skin is not like a lot of other people's. I'm very, very prone to scarring, very, very prone to breakouts. To this day, I still get cystic acne. So I have to be significantly more careful of what I do to my skin. So I actually started making my own skincare products because I was so fed up with all the ingredients in skincare products that were causing me to break out. So I made my own skincare products, and my acne actually started to go away for the first time. However, I was left with a ton of scarring, and I will get into this in the webinar, but my skin type scars, every little thing will leave a scar on my skin. So every pimple I've ever had in my life has left a scar. I think it's very important when you microneedle to make sure you're using the right device to not further, intrude further scarring, especially for the jowls area. So I went to a plastic surgeon friend. I wanted to get a laser treatment done for my scarring. He said that the laser would make my scarring worse. It was not good for someone with a darker Fitzpatrick skin tone. And he actually recommended microneedling with vitamin C. This is over 14 years ago, okay? So microneedling back then was not talked about. No one knew what it was, but I tried it, and I used a vitamin C serum with the microneedling. And, people on my YouTube channel started commenting left and right, Daisy, what are you using? I want to buy it. Put the link of the product below, like whatever it is you're using, I want it. So that is when I knew that microneedling was something that people didn't know about. I wanted to help other people. I wanted to give my audience the same solution. And by far, microneedling for anything has been the best thing I've done to my skin. So I created the first Banish kit in 2013. This is what she looked like back then, the first prototype. But I have been doing this for, I feel like, a million years, for 13 years. So I have always been, my mission is to create the safest, most effective, affordable version of at-home microneedling. And one of the Banish methodology, our mantra is, everything is based on science. So everything in this webinar is going to be based on science. I don't like to put bells and whistles in something that there's no science behind it. I don't like to add things to make it look cool. Like if there's no clinical data behind it, I don't want to do it. Okay, so this is also why we don't launch too many products. We don't have too many SKUs, and we really focus on creating the best at-home microneedling device. And so from there, I was awarded a lot of accolades, Forbes 30 Under 30 Manufacturing, did a TEDx talk, we had a billboard. So it's been a really amazing ride and so much fun developing these products. Okay, so why did I get into Jowls? Well, after having my second child, I gained over 55 pounds and everything changes, right? And I was left with a lot of jowling, necklace lines from the rapid weight gain, but also the rapid weight loss afterwards, okay? And so that can be one of the contributors to jowls is rapid weight loss or weight gain. So what are jowls? So let's get into jowls. So jowls are excess or saggy skin around the jaw, neck, and chin. They become more common with age as skin naturally loses elasticity. And it also occurs during rapid weight gain and loss. Okay, so there's a few factors that lead to jowling. One of them is dermal collagen loss. So, after the age of 20, our body produces less collagen every year, 1% less, but it dramatically decreases during perimenopause. All right. So microneedling can help with the dermal collagen loss, reduce elastin, right? Collagen and elastin fibers, but also other like structural changes that I think is important to talk about, because I'm not going to tell you that if you microneedle, all your jowls will go away. That is definitely not the case. There's a lot of structural issues, which you will have to see a plastic surgeon about. Ligament weakening. So the ligaments that connect your face weaken over time, right? So fat pads shift. Okay. So like when you're younger, there's more fat and then it kind of moves. And then also age-related bone remodeling. So your bone kind of reabsorbs itself. It becomes not as strong. And so if your bone structure changes, the way your skin hits also changes. Okay. So a lot of this is, natural. It happens to everyone. But what I think is so great about microneedling is that we can at least control the first two a little bit. Okay. So yeah, same thing. Jowls involve thinning of the dermis, loss of jawline definition, gravity acting on weakened tissue, decreased elastic recoil. And then this was an image I got of the fat migration and the structural loss and structural change. And this is also why it's very important when, for example, there's like radio frequency microneedling that's very, very popular, to just be careful if you want to melt fat or decrease volume, because over time it can also create heavier skin on the bottom. Okay, so what can we do at home, right? We can definitely impact the skin firmness, the collagen induction, the fine lines, and the early jawline softness. So it's imperative that you start now and you do it consistently, okay? Because you can go through all the clinical data about microneedling and collagen production, but it's not like you do it once and then you're good to go. I've been microneedling for over 13 years. It's definitely a consistent practice that you need to do. All right. But however, at home, you can't change your fat pads. You cannot change your bone structure, and you cannot, lift certain things at home. Okay. So what is microneedling and how can microneedling help with the jowls? So microneedling is also called percutaneous collagen induction therapy. And what microneedling does is when you prick these tiny little channels in your skin, it releases fibroblasts. And that also releases different growth factors in the skin to help build the collagen and elastin fibers. So it will kind of strengthen the skin around anywhere you microneedle, but especially around, under the chin, the jawline, and the neck area. Okay. So microneedling can help improve the skin matrix that contributes to jowls. And every time I do these webinars, I am always so fascinated by how much data there is behind microneedling and, just the amazing results consistent microneedling will do to you. So in the article, Microneedling Advances and Widening Horizons, it notes that new collagen is laid down approximately 3 to 6 months after treatment, leading to lasting improvement in skin thickness. So you can see here, this is a biopsy of microneedled skin. So on the left was pre-microneedling, and on the right was after microneedling. You can see how much thicker the skin is on the right side. And this happens, even 3 to 6 months afterwards. So this is why I say it's very, very important to be consistent. The skin remodeling, the skin healing takes time. So it's just super, super important to keep doing it and to keep being consistent. You guys know that I am kind of a nerd and I'm always big on science. So this is kind of how microneedling will help with the collagen production in the skin. So there's 4 specific stages of how the skin reacts to microneedling. So the first is when you prick those tiny little channels in the skin, right? Growth factor hormones called TGF beta 3 releases like the signal to your skin to keep producing collagen and elastin. And what I think is so important, if you guys take anything away from this, is you want to create enough collagen in the skin without creating further permanent scarring. So again, if you're someone like me that scars to everything, you have to be very careful about the technique you do to induce these growth factors, because what you don't want is scabbed skin that creates more scarring. Okay, so because I've used other treatments and other things, the needles were way too thick, it was too traumatic, it has actually left permanent scarring in areas where I wanted to get rid of scarring. Okay, it's really important. So what happens is that, these TGF beta 3 proteins are released and they help stimulate new tissue formation and increase blood flow. So this is why after you microneedle, you get kind of red, you get kind of flush, you get kind of that sunburn look. Okay, and then you have inflammation here, and then the proliferation phase. Okay, so that is from 2 days to a few weeks post treatment. So new skin cells, keratinocytes proliferate, leading to epidermal thickening. So a type 3 collagen is deposited into the dermis. But the thing I love about microneedling is that this keeps happening months post-treatment. So a type 3 collagen is gradually replaced by a type 1 collagen. So actually a new form of collagen comes in, it's stronger and it's more durable, and it helps improve skin elasticity and tightness. So this happens, months from microneedling. So can microneedling help jowls? So it improves the skin quality, helps with the skin thickness. The type 3 collagen is replaced by type 1 collagen. So it can help with that, jawline transition, softer shadowing. But again, we're not, expecting a full facelift here, okay? So that's something really important to know. And so many amazing studies about how microneedling has helped signs of aging skin. So this one that was published, 48 subjects aged 35 to 75 with signs of facial aging were recruiting. They did 4 microneedling sessions 30 days apart. The conclusion of the study demonstrates wrinkles, skin laxity, skin texture, 90 and 150 days after treatment, significantly improved fine lines, wrinkles, skin laxity, and skin texture. And this one, I learned this term, perioral retides. Have you guys heard of that? Perioral retides? So they're like the smoker lines or the straw lines. I'm not really sure, okay, what y'all call them. But here they actually did microneedling on the upper lip. And I think it's really important to point this out because I've always been microneedling for acne scars, which is along the temples of my face. But I totally, I'll admit, I do not think about microneedling here. So this might be something if you want to work on the bottom half to microneedle. So let's see. So here's a before and after from this clinical journal by Ulster and Graham, and the results were microneedling produces substantial clinical improvements of scarred, striate, and retides with expedient recovery and limited side effects. Controlled dermal wounding and stimulation of wound healing enhances collagen production is likely responsible for clinical results obtained. And I just love how in their study they said they noticed significant increases in type 1, 3, and 7 collagen and elevated levels of tropoelastin. Okay. Amount of dermal collagen was shown to increase with cumulative treatments. All right. So yeah, They want to do, bi-weekly or monthly microneedling sessions to achieve optimal improvements of retides and skin rejuvenation. All right, so next time you use your banisher, let's banish along this area. Okay, and I will do a little demo on how to do this. Yes, let's get to these studies. I have my timer on to make sure we don't run out of time. Okay, and then again, another study. I mean, I could go a full 24-hour seminar on the data behind microneedling. But, again, a significant increase in levels of collagen type 137, synthesized collagen tropoelastin, and the effects are enhanced when the procedures combined with a topical anti-aging vitamin C serum. Okay, y'all ask, why is the Banish kit, why does it have the vitamin C serum? Because I want the maximum level of collagen production in your skin when you microneedle. Okay, there's so much data behind it, and it has to be a very specific form of vitamin C, which I will get to, but you can see that vitamin C directly contributes to collagen formation. So yeah, this is kind of how it works. And again, it is so important when you microneedle that you don't create more scar tissue, because you're naturally developing a scar tissue from the collagen induction. But again, you don't want it to be noticeable. Okay. So again, if you take anything out of this, don't assume that more trauma is better. I have so much more scarring from trying to treat everything. You just want to be really careful with the technique, the device, and how you use it. Okay, so this will be last part of why we have vitamin C in every single Banish kit, okay? Everything I do with Banish is based on science, and I've studied this a lot. I'm not going to go too into detail, but there's proline and lysine, which are the fundamental, collagen synthesis needs the hydroxylation. So L-ascorbic acid, which is in the vitamin C serum that we have, needs an OH factor to proline lysine to create iron and vitamin C to create the collagen mRNA matrix. So the structural protein of collagen needs the OH from the ascorbic acid, transfers over. Okay. Now, if you don't have this, deficiency in some of these cofactors leads to impaired wound healing. So it means that the wound is not going to heal as well. Maybe it doesn't, it leaves a scar tissue instead, maybe it doesn't heal like as nicely. So this is why in every single Banish kit, there is a vitamin C serum. Okay. All right. Because for me, it's like, I don't want people using whatever is hype. I want the science to be behind there, like what is directly contributing to collagen formation. Very quickly. So professional radiofrequency microneedling. So this is not something that, you're going to have to ask your provider. And if you're going to do this professionally, if you're going to get any treatment done, please get multiple opinions. Okay. There's some people out there who generally want what's best for you, but then there's some people who are willing to make a lot of money, right? And so you want to make sure that you get multiple opinions. So if someone says, you're not a good candidate, you can really understand why. However, I just want to caution you, radiofrequency microneedling has been recalled by the FDA. They issued a lot of warning letters because what it does is, yeah, it can tighten the skin, but can also cause fat loss. Okay. And again, the fat loss contributes to some of the jowling. So temporarily, it might look nice, but we always want to take a long-term approach to your skin. Okay. Yeah. So at home microneedling, right? We're doing mechanical collagen stimulation. You definitely don't want to go too deep, not too traumatic. And again, it's consistency. Okay. You want to do this over a decade. Like it takes time to do this safely. Okay. So I am going to really quickly show how to microneedle and what you need to do. So I have my Banisher. I already cleaned these. Okay. And I would suggest starting off with a 0.5 millimeter. Okay. But what is so great about the Banisher is you want to go along the jawline. Oh, can I make my screen big for the demo? How do I do this? Okay, it's my screen big. Okay, so yes, you want to go along the jawline here, okay? And again, this is something, I will be honest, I've always focused on the acne scarring. So now I'm like, okay, well, I have to microneedle my bottom half, okay? So yes, you want to just do it along here. Now, if you have like folds, you can gently lift it up and go. So you can see I'm having nasolabial folds, so you can just gently move it here. All right. So you want to make sure you're doing the bottom half of the face. And then for the perioral retides, right, you want to make sure you are going around the lip area. Okay. Now, something I do is is I like to kind of blow like this, so it gives a firmer surface to go along the sides, okay? And then you're going to microneedle along the sides of the face, the chin area. Now, why the Banisher 3.0 is so good for this is because you get so much more targeting and control, especially under this area, right? So actually, depending, what you got going here, you could actually go to a 1 millimeter needle. I would start with 0.5, but if you have more, thickness there, right, you can really target and go underneath the chin area. So that's something that I will admit that I have not thought about, but I'm going to start. Okay. So microneedle underneath. And again, the Banisher is way easier to use. If you're going to use a derma roller, like, you're not going to get that targeted precision, right? If you're using a motorized device, it's going to be more tricky here. It's just literally stamping it. Are you going to shrink the fat under the chin? No, you're not going to shrink the fat. You're just going to make the skin stronger. All right. Fat loss is a whole nother thing. You're going to tighten the skin, not the fat. The fat is underneath the layers of skin. Okay. But you can see how easy the Banisher fits. No problem. And then just kind of go down to the necklace lines. Okay. And then down to your neck. All right. So any questions here? So just making sure that you're doing the sides of your face, you're doing the jawline, and you're doing the perioral rhytides, and then the nasolabial folds. You can gently, of course, like, move the skin up a little bit, but I wouldn't tug. All right. We don't want to create more issues. Okay. All right. So I'm going to share my screen. Yeah. So you want to use a manual stamper because of these reasons, right? Controlled pressure is really important. So the Banisher stamp, the way it's designed is all of the pressure goes into this conical shape, and it's even pressure, right? With some of the other devices, you don't know if you're getting even pressure, you're risking tram track scarring. There's very precise placement, and ergonomically, it contours along the jawline really well and along the bone structure really well. That's much harder to get with maybe some of the other devices. And then when you're done microneedling, you always want to put the Banish serum on top. Again, reason why I include it in the Banish kit is because it is clinically shown to increase collagen production. Okay, so just really, again, be careful. You guys know that safety is so, so important for me. Okay, I have more scars trying to treat everything than before. So just be careful with using rollers because they can drag, they can create tram track scarring. The motorized pens, you know what? If you have to be really careful. It depends on who's doing it, how hard they press, because it is a vibrating device. They can press too hard and it can really tear the skin. And if you're using numbing cream, you won't know until the numbing cream wears off. And, there just can be really negative results. And to me, it doesn't seem necessary to induce that trauma, especially when there is no clinical research that motorized devices perform any better than a manual stamper. I have not seen any data behind that. So to me, it seems like, something cool. All right. Again, safety when using the Banisher, very, very important. You guys need to replace the heads. I always say, like, you can use, there's a guide inside the box of the Banisher of how often to replace, but I always say, when in doubt, replace it. So this was an image from Stanford trained physician, Dr. Sarah Shu. And she used the Banisher once and she zoomed in 200 times, and you can see there's skin debris, and that is impossible to remove even after cleaning. So you can see the needle quality is still very good, but over time, if you constantly reuse it, you're not going to get as clean of a pierce as a brand new head. So I didn't want you guys to have to change your heads every single time. I think that's very wasteful, but at the same time, you have to be very careful with not overusing it. And then, the Banisher has the thinnest needles out there. You can just see how pointy they are, straight and sharp they are, and they are thinner than the size of a human. Again, what makes Banish different? It's very precise, precision focused. Other devices, there's no way to clean them. You can see the needles are much thicker on the other devices. So if you're like me and prone to scarring, you may scar from using them. Okay, so Banish jowl protocol. I would say every month, start off every month with a 0.5 millimeter. And if you're doing well, okay. So when I first started microneedling, my face was red. It would be like really red. Now I don't get red anymore because my skin has gotten so much thicker from microneedling. So it doesn't really affect me that much. But when you first start off, start with a 0.5, do it every month. Then you can do it every other week. Okay. And if that is good for you, you can then move on to the 1.0 millimeter. I don't want anyone starting off with a 1.0 millimeter. I know it's going to be tempting, but honestly, you don't need to. A lot of research has been shown that 0.5 is a really good depth for collagen induction. Your skin is only a millimeter at its thickest if you are over the age of, a certain age. So you're going to hit other areas that you don't want to if it's too deep. So yes, under the chin. I know. I learned something, right? Under the chin. It's a great, great spot to microneedle. Okay. And then, you want to stamp jawline, chin, perioral lines, and then this part of your neck. Definitely apply the vitamin C serum on. Okay. And then first 48 to 72 hours, it is not the time to put on a heavy face of makeup. You want to avoid any, chemical peels, retinols, all of that. Ideally, no heavy makeup that day or the day after. I would say, you can wear like a tinted moisturizer, some mascara, like very light makeup. I've gotten to the point where I microneedle and I can pretty much, because my skin has just gotten so much thicker over a decade of microneedling, it doesn't affect me as much. But yeah, if you're just starting off, you want to make sure that you're not doing too many things to the skin. Yes, you definitely have to be consistent. Okay. Like I wish I could sell you magic jowl removal in a bottle. Like I would be, on my yacht, but you know what? It doesn't work. You have to be consistent. And I'm all about long-term, right? So we all are going to, age. We're all going to get jowling. We're going to get different facial structural changes, right? But at least we can do something that is very natural to make our skin stronger. Okay, so I wanted to quickly talk about microcurrent devices. So microcurrent can really help with the appearance of jowls and help with temporary tightening, but it is not a structural fix. It does not remodel collagen the way microneedling does. Okay. So there's these microcurrent devices. It can help temporarily lift and tighten the skin. I don't see a downside using it, but it's different because it doesn't change the way the skin is structurally. And if you are going to use a microcurrent, a fighter gel, you need to use a gel conducing product. So the fighter gel is also really great for that. Okay, just have a couple minutes. So I think it's really important to have realistic expectations too. Okay, I'm not in this, I'm not going to sell you something and say your jowls will disappear tomorrow. So again, microneedling can help improve the firmness, smooth the lower face, and help with the early jowls. Again, the sooner you do it, the better. The more consistent you do it, the better. But it cannot replace a facelift or other more surgical conditions. And then, definitely do not microneedle over active acne or infection. If you have poor wound healing, if you have a history of keloid scarring, all of that. Does it help with marionette lines? Yes. So marionette lines are the same as the nasolabial folds I was talking about. And so what I do when I microneedle, I do like a area around here. And now we gotta do under the chin now. Yeah. So for early jowls, in conclusion, Banisher provides safe, controlled at-home microneedling for jawline, chin, and neck. And it is a great microneedling solution for jowls.